Welcome, welcome everyone. I wish I could see more of you, but I am very glad to know that you are there. Today is our first virtual session following our in-person sessions, which was pretty much a month ago at this time. So for the month of May, we are focusing on doing a deep dive into Teach Back. And I'd like you to recall that this came from the framework from the AHRQ, which the mnemonic that we're using to remember is tap CV. So for the next 4 months, we'll pick each of those. The last month we'll do two at the same time. But today is a training, so I'm going to ask you to bear with me. I am going to talk at you a lot. But next week, we are going to focus on doing the activities part of this training, right? So today's focus is getting to the anatomy of a great teach back prompt. I will go through the learning goals and then we will just take a little bit of a refresher into TAP CV and then get into the actual content. So this is a very different setting. You can't just raise your hands. I can't see most of you, but I'd really like you to feel free to get off mute and interject, ask questions, make comments, right? If you like, use the raise hand function to get my attention or just get off mute and start speaking. Let's try to recreate the conference room that we were in. Okay. So, uh, Lucinda, I think you have something uh, something making a noise in your background. Thank you. Thank you so much. All right. So we have just an hour today. We're going to make good use of the time. We're going to push through. We'll start with reviewing the learning goals very quickly, and we will have what I'm calling the accountability minute. Remember the last activity we did before we wrapped up? We're just going to check in on that with your accountability partners. Then we're doing a quick tap CV refresher. And then the bones of today is this anatomy of a strong teach back prompt. I want to remind all of us that teach back is not necessarily something that comes natural to us. We need to practice it. We need to repeat it to get comfort and fluency. So we're also going to look at some teach back do's and don'ts, some things that you may say that actually backfire from what you're trying to do with teach back. And then we'll talk about next steps. Okay. All right, so here are our goals for today. We're going to learn some, I call them rules, but it's more of guidelines that you keep in mind for composing a teach back prompt. These are the ways in which you invite people to participate in teach back. You continue the conversation with them in teach back. So we'll learn a framework that helps us remember those. And this is good not just for healthcare, right? There are many times in our life that it would be helpful to have people teach back to us. Then we're going to practice some ready to use teach back prompts, right? It's hard to do things on right on your feet if you haven't thought about it. So this is one of the reasons that we are carrying this training through the next couple of months. Then we'll also learn some phrases to avoid, right? That some of them seem innocuous, but they actually work against you when you're trying to do teach back. Okay. So I just want to preview next week because then I want to give you hope that even though today is going to be a lot of just hearing me listen, next week is when we're going to do a workshop on this. You're going to bring in some things from your daily life, and we're actually just going to sit down for the hour and create your bank of teach back prompts that you can have in your back pocket and use over again, right? And then we will also do the teach back prompts for some common healthcare situations working peer to peer to improve them. Okay. So let's dig in by starting with the accountability minute. I hope you do recall that on April 4th, we all made a commitment in writing, right? Do you recall there was a post-it note? You wrote one concrete action that you would take around the TAP CV framework. You had an accountability partner that was going to ask you about the progress during the virtual sessions. This is the virtual session now. So just so that we don't spend all the time reporting out on the amazing work that you have been doing, I'm sure, I propose that we use the Zoom chat function, right? And if you are not super uh, 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 familiar with Zoom, I know there's Teams and such. It's when you click anywhere on the screen, you should see chat, right? And then you can send a message to everyone or your accountability partner. So this is what I'll ask you to do. Send a message. You can do it to everyone or find your accountability partner. You can find the partner by clicking the everyone that's in blue and it drops off, but you can just share with everyone. We are a small group today. So send a message that covers what your commitment was, what you've done so far, and what you plan to do next. And this is a question that I am going to ask each month because it doesn't stop really at one thing, right? I remember many of you saying we left on a Friday. On the Monday, you were going to tell somebody about TAP CV. You were going to use either pictures or teach back in your daily life. So write what the commitment was, what you've done so far, and what you plan to do next. And if it's, I have thought about it and I will plan to do something next month too, that's fine. So let's see what's happening in the chat. And we're just going to give 1 minute to that till 12:10 on this. Right. So far, let's see what's in the chat. Okay, thank you very much, Gary. And how's it going?
Oh, it's
What you,
good. I was at an event yesterday and learned a lot more heavy trauma-informed care. It's a sexual assault and domestic violence awareness month. So um, conversations were pretty heavy in that aspect of trauma-informed care and incorporating culture in the discussions.
Thank you. Thank you for sharing that. Who was your accountability partner, Gary? Do you remember?
I don't remember. Oh, I know who it was. It was Teresa. Or no, not Teresa. It was uh she's always on the calls. I forgot. I know I
Okay.
Hazel,
Okay.
her name.
So I don't see things coming into the everyone chat. Does that mean that you're sending private messages to each other? All right. Thank you very much. Oh wow. Dr. Nathan, you've been doing a lot on this. Thank you very much for sharing that.
Went well. I had a lot of positive feedback from the providers, and I spoke to everyone. But yeah, they especially like the teach back. So
Oh, that's great.
yeah,
That's great. Thank you. We are almost at the end of the minute, but that doesn't mean that we are not going to check in on this. Um, Thank you very much for sharing that, Emily. I'm going to be a little bit of a pain on having this question about the accountability each month, because I know you are doing a lot and it's not necessarily something that floats to the top amongst what you need to do. But let's see, having at least for the next 4 months, this space as a reminder and as a tool to help us bring to the forefront the importance of health literacy. Okay. All right, so our minutes, we are at 12:10. Our minute is up. So now let's get into the bones of what we're going to do, right? Dr. Nate told us about how Teach Back was something that a lot of people resonated with. Incidentally, we are starting with Teach Back today. So TAP CV, as a quick reminder, TAP CV is a mnemonic. It's a simple memorizing tool, which is derived from the Health Literacy Universal Precautions Toolkit. The T that we're talking about today is the teach back, right? So we are going to go through each of these letters over the next couple of months, do a training. Thank you, Teresa. Do a training and then do the workshop. So today's training, let's just move on to the deep. Is coming up with best practice prompts for teach back. And what is teach back? Asking the patient, community member, whoever you are speaking to repeat the information in their own words to make sure that they understand. Now, this is a very good intention, but the reason we're doing this training is the good intention alone is not enough. It actually takes practice to be able to have do teach back effectively. So on the next couple of pages, and let me show you, one of the ways, and I try to take what I'm teaching into practice, one of the ways in which we are going to learn is through pictures and words, right? That multimodal communication. And as I was thinking through this session, I thought there are some core principles that you need in a teach back prompt that's going to be kind, clear, and effective. And the way that I would like to support you in remembering is to think of it as like an anatomy and something very simple. This is a simple flower. I don't even think it's a real kind of flower, right? But there are 5 elements that this image is intended to help you remember. So for a teach back prompt, and that a prompt being the way in which you invite someone to first uh, into the mindset that they are going to repeat back what you've said to them, and then also to urge them to think through and retain what you shared, right? So the first thing about the prompt is you need to acknowledge the difficulty, and we'll go through each of these in a bit more detail today. And then, as I mentioned, we'll practice next week. You need to acknowledge the difficulty of whatever information you're sharing. We'll talk about some of the do's and don'ts over there. The second part of the anatomy is you normalizing the process. You are not singling them out because you think they are somehow incapable or anything that makes them feel judged. So there's something about normalization of the conversations. And then the third is sharing responsibility for the clear communication. It's not about putting a burden on them to be able to track or understand everything you've said. It's understanding that there may be ways to explain that resonate more with one person or the other. So, in this framework where I'm trying to get you to connect these different elements also to an image, the think of it, the flower pot is acknowledging the difficulty. So even if you don't remember the words, try and remember the image. And then the petals is about normalizing the process. I think this is a stamen, or let's call it middle of the flower, sharing responsibility. The next part is about breaking information into smaller parts. It's always important to understand that no matter how complex something is, if you break it up into sufficient parts, it generally becomes more manageable. And then the fifth core element is making specific focused requests. So this is a new framework that I am putting in front of you, sharing with you. Before we move in to talk about each of these components, anyone have any thoughts or comments to make? I would very much like to see or hear from you if this flower imagery is also helping, because this is essentially a list of 5 things. I was like, how do we put a list of 5 things in a way that people remember, right? So, so far, this is just the beginning of the framework. We're going to talk about how to apply each of these components. Thoughts, questions so far? Shall we press on? Okay, I will take the silence as we are ready to now move into detail. Okay, so the first part of this anatomy, acknowledging the difficulty, what does it mean? The foundation of any strong teach back prompt is naming that it can be challenging, right? Naming a challenge builds trust between you and the person that you're speaking to. Ignoring that this can be quite difficult information can break a connection, because then it becomes a them versus us. Like, oh, you understand what you're saying, I don't understand, I better just nod along, right? So acknowledging that the information you are sharing may be difficult to understand is the foundation of any teach back thing. And coming up with phrases that sound like you, sentences that sound like you and work in the context is something that is helpful to do ahead of time. So there are some do's and don'ts with this. You are expressing empathy that the information is complex, but you also want to be careful that you don't make any assumptions about the person's understanding. Maybe you are saying something to them about diabetes and they happen to have had a family member, they know everything already. It can be true that the information is complex and they know what needs to be done. So the other thing is you also want to make sure that you don't dismiss that, oh, this is so easy, everybody knows. Okay. So again, please jump in if you have any thoughts or questions, comments. Let's look at these phrases for what it can sound like, acknowledging the difficulty. One thing to note is that these are shaped to fit like the way that I would speak, for instance. But you would have to do a little bit of work, and we'll do that next week to make sure that they sound like you. You also don't want to sound like a robot. So let me go through some of these. Healthcare instructions can be confusing even for people who work in healthcare every day. And that is simply true. And especially if you are working in healthcare and saying that to them, adding in a little bit of your own personal experience, it seems genuine, and that's what you want to do. The more truth and earnestness and being genuine, the more it comes out and they feel like, oh, this is someone who really understands, right? So another sentence we talked about a lot today, and it can feel overwhelming. That's also just simply true, regardless of anybody's knowledge they have already or their background. This is a lot of new information all at once. It's completely normal to have questions, right? These instructions are like a whole new language. It's okay if it takes a few tries to get comfortable. I realize some of these steps sound complicated the first time you hear them, right? So I would love at this point really to get a sense if some of these phrases that you've found yourself using, things that you've heard others use, and if it fits the tone for the most part for how you would use them, how you would acknowledge that something is difficult, being sure not to be dismissive. Anyone? Is Dr. Alethea here? Because I remember you said something. Yes. In any of our physicians in particular. Oh no, I'm so sorry. Okay. Dr. Alethea has laryngitis. Let's push on then, but please do feel free to interject here. I think importantly, having these examples that you can then tailor to make your own is one of the goals that I have. Now, just as important is also, there are also some phrases that you want to avoid. As I mentioned, the intention can be there, but you can actually end up doing or saying things that backfire. So phrases that end up either dismiss or shame, you want to be mindful of them. So saying something like, this should be pretty straightforward, so you shouldn't have any problems. Why is that problematic? What if someone is having a problem, or for that person, either because of the information that they are getting or the mindset they are in is very overwhelming, right? This is something to be careful about, to not to dismiss that it may be actually difficult for them. And another flippant comment that you may not realize that it's actually bringing shame, it's just common sense. Most people pick it up quickly, right? Some of these are just like, if you sit and think that was kind of rude, but it could come out, right? I already explained it once. Hopefully, it's clear now. It's one of the more insidious ones. It doesn't seem like it's that bad, but what it does is blaming the patient if they don't understand, right? Maybe you need to explain it in different ways, or you need to explain it 3 times. You'll figure it out once you get home. Leaves the patient feeling unsupported. I remember once I had to give myself Lovenox, which are these blood thinning injections. Um, and I was told that I'd figure it out when I get home. And the short form is I never did figure it out. I couldn't give myself the shot, right? I don't think that was the cause of it, but I did end up getting a blood clot anyway. Right. But just something like that, it leaves a patient feeling like they have to figure it out. Just follow the instructions exactly. It's not that complicated. Maybe for you, maybe for some others, but there are some real barriers that people may have. Okay. So just to recap around the acknowledging the information is difficult to understand is there are some phrases that are do's, others that end up being don'ts. Okay. So I'm going to push on. Remember, today is lots of talking at you, and I'm sorry about that. Normalizing the process. Again, what does this mean? Framing the fact that you're doing teach back with them is that it's routine. It's something you do with everyone to check their explanation. Your explanation, not their ability. Right? You want to be careful to not make teach back feel like one is a test they have to pass or it's a punishment somehow that they are getting because of who they are or the situation that they are in. Again, some of the phrases that can help. And as we look at these, think through, how do I make it my own? I ask everyone to explain things back to me just to make sure I explained it clearly, right? We do this with all our patients. It helps us know we're giving good instructions. This is something I always do because health information can be tricky for anyone. Okay. Even if it sounds simple, I like to double check that I explained it the right way. That's part of how we work here. So notice that all of these things are making it like this is just commonplace. You are not being singled out. Okay. So the the make sure not to do's, right? And I can't stress enough how it takes practice. So don't feel defeated or discouraged if maybe you've even said some of these things. It takes practice. This is why we're doing the training. So, phrase to avoid. I need you to explain it back to me because sometimes people like you get confused. I mean, that is in many ways making judgments is also stigmatizing. What even if there is some pattern you've noticed, you don't you make sure that you don't put it out there that way. Otherwise, the invitation for them to ask questions, to really make a joint plan with you, it goes away when people feel singled out. I'm not sure if you understood, so can you repeat it? This is one that again seems quite innocuous. You're not sure if they understood, so you're asking them to repeat it. But what that does is it blames the patient for any misunderstanding that they have had, right? So this is where you go back to saying something like, I just want to make sure I explained it clearly. Not that I'm not sure if you understood, so can you please it? I'm just going to check your understanding to make sure you were paying attention. Now, if that doesn't feel like a test, right, that I am not sure what it is. So it would imply that the patient is the one who was not paying attention if they didn't understand. Okay. Since this is complicated for some people, let's see if you got it. It seems also like a test. Who is some people that you're talking to? Hopefully you caught everything. Tell me what you remember. Another one that is like in disguise, but quite off-putting when you think about it. Hopefully you caught everything. Tell me what you remember. So it's assuming that the patient is the one who has to catch everything. Right? What if you are not putting it out there in a way that they can relate to or in a way that they understand? Okay. Let me take a pause here. We've done two parts of our flower framework. We've done the root, the foundation, acknowledging that what you are sharing may be complex, and then normalizing it. Okay. Any thoughts or comments? Are any of these phrases, the what to avoid as well as what to say, somewhat surprising here?
Afua, this is Anna. Good morning. How are you?
I'm well, thank you.
No, I just appreciate it. I think that this information is just so critical. I know that often when I was in my advanced practice training, clinically, they didn't spend a lot of time, on these conversation pieces. It wasn't until I was in practice and, when you're a novice, you tend to be really zeroed in and focused on what it is that you have to do, right?
Right.
And these are in support of, almost helping facilitate people to remind them about being more patient-centered. And I think especially historically, a hallmark of medicine has been of a dismissive nature. And so I just really appreciate, from a clinician standpoint, but also from a patient standpoint, the incorporation of this into this part of patient engagement, health literacy, because I think it is critical. I think all too often people forget why they come to the clinic to see patients. It's to focus on them, and making sure that the output is as quality experience as possible. Because without understanding, it's just it can be a waste of time and effort. We want it to
And
count.
breaks connection. Yes. Thank you so much, Anna. Thank you so much. And especially when you think about the fact that this is something you have to do on the fly, on your feet, right? This is why we practice, so that it becomes part of what it is that just comes naturally to you. Thanks for sharing that. Anyone else have any thoughts? I know Anna, from a clinician point of view, but someone who's speaking to community members, maybe. And that's okay if we should just press on.
I
Addie, did you
think
have something?
yeah,
Okay.
I
Yeah.
had a strange experience with an cardiologist. I was asking him about some medication that I was supposed to begin taking. So I was asking if
Addie, it's a little bit hard to hear you. I don't know if it's just me, but it's coming in a bit muffled. Actually, no,
I think
that was.
something's wrong with my speaker.
Oh,
What's
I
it?
can hear you now. Now I
Okay.
heard that something's wrong with my
Okay.
speaker.
Yeah, I was just going to say that
Yes, much better.
when I had an appointment with my cardiologist, one of the things that he did to me was, when I was asking about um, a new medication that I would be placed on, I asked him how, you know, the side effects, or, whether this was a good option for me. And he went back and quoted a study that he had read. And it was something like, well, according to the study, which was conducted back in, 2000, those participants, and he went on, and I thought that was so inappropriate. I mean, I, I understood what he was saying, but I mean, to say that to a patient who probably doesn't understand what this study was for, why they were conducted, and how relevant it was to my visit, was, I don't think it was appropriate at all.
And I think we do have empathy both for your experience and for the cardiologist who just maybe, as Anna mentioned, had not had a chance to think through the how you adapt language so that you're not talking about a study to a patient who is living the experience. Okay, let's go to the third part. I keep coming back to this page because I'd like you to get the context of this, how to build a best practice prompt. You start by acknowledging, normalizing, and sometimes it's just a few words. And then, very importantly, you share responsibility for the clear communication. So this is something, Adi, that your provider probably didn't have a chance to reflect on. You share responsibility. It's not for the patient or the person you are speaking to, like maybe you're talking to someone about the importance of immunization in general. It's not for them to go back and refer to studies. How do you make it so that they understand and it's relevant to them? So the core message for anyone to remember is that the clear communication is a shared task, right? It's not the patient's burden alone. In fact, it's not the provider's burden alone, because the patient also has the responsibility to ask questions, ask for clarification, push and advocate for their understanding. From the provider side, you in a way, the way you share responsibility is to take ownership for some of the potential breakdowns that may happen. Because if they didn't understand something, maybe you need to explain it in a different way. It's not that they have failed. Or you need to, and actually, I regret using this word better here. It's a different way. It may be better for someone and not as good for others. The thing to watch out though is not to act frustrated, not to get frustrated. Even if you get frustrated, not to act it or not to blame the patient for that confusion. And one thing that helps here is if you grasp and truly believe that there's a shared responsibility for the patient to understand what you said, it actually helps you keep your cool because you come from a place and a mindset of, okay, they are not getting it because I haven't reached them in the way that they need to be reached. Let me think of another way, right? And some of the let's talk through some of the sentences that you could use for shared responsibility. This is one of the places where you'd really need to how what's the word here? You really need to adapt it to your particular context because you don't want to also be always blaming yourself, right? But this idea of working together. So an example phrase, it's my job to explain this clearly because it is. So let's work together to make sure it's right. You've shared something. If something doesn't sound clear, it's not your fault. It just means I need to explain it differently. That's also just simply true. Sometimes I don't explain things as clearly as I could. Let's go over it together. And this one is not putting blame on you, either the health promoter or the provider. It is simply true that when you do something all the time, you begin to take parts of it for granted, right? Oftentimes, my kids point out to me when I'm giving them steps to do something, I've skipped like 3 or 4 steps because in my mind, it is like, oh, of course, they know this part A to B to C to D. So it is true that sometimes it's possible that you may not have explained it as clearly as you could because you skipped steps because it's too familiar to you. Another way, say, if anything I said was confusing, that's on me. I want to make sure it makes sense, right? This is a team effort. If anything doesn't make sense, we'll figure it out together. So some of these are more of you taking most of the burden. Others are more in the direction of is we are working as a team. Let's figure it out. Okay. But this is where we'll work together to create a list that feels like you next week. Things to avoid. As it says, even unintentionally, you can end up losing people's trust. You can end up losing any chance that they'll actually learn from what you're saying. Weren't you listening? I already explained this. Okay. That is blaming. Blaming. Ah, you should have asked if you didn't get it the first time. That's already also putting blame. And notice some of these things are very, they seem flippant because in day-to-day work, when you're juggling 10, 15 things, it's possible for something like this to spill out, right? But you want to be mindful of them. It's really not that hard to understand. I know I've said this so many times, and as I was writing this down, that I was like, "Oh my God, I do this all the time with my kids, especially." Um, it minimizes its shames. we should try to avoid those. Just read the instructions again when you go home. These things about the instructions. It's abandoning the fact that you are supposed to be helping them, right? Um, and what if the instructions themselves are not clear? You are the one who has to remember this, not me. Shifting responsibility onto the patient. All right. So this part of sharing responsibility almost flows naturally from when you've acknowledged that it's hard and you've normalized it. Then you're saying we're doing this together. Okay. So thoughts, comments, questions at this point? I hope that as you are sitting and hearing this right now, you are able to reflect on it, because we're going to use these next week when you are building your own prompts for your own context. The fourth element is to break information up, right? Whatever it is, break it up into smaller parts. And you may think like, wait, isn't that the same as making specific? No, you could break it up into a small part and still be rather vague about it. This is why it's explicitly a separate point. So um, keeping to one part of what has to be done at a time and then going through it, it may actually end up saving you time, because when you do the whole thing at once, there's so much confusion, then you have to repeat yourself multiple times. So taking one part at a time, teaching a small step at a time, will actually end up potentially saving you time. So being careful not to put too much of a thinking load on someone when you are giving information. How does this sound like, breaking information to smaller parts? Okay. Examples. Let's just start with how you'll take the morning medicine. We'll talk about the evening dose after that, right? So instead of saying something like, how would you take your medicine 2 times a day, is something breaking it up in that way. Um, and one thing or one tip that helps a lot is when you are using the words first, second, third, or also then and after, right? That gives you a clue that you're breaking this up. So another example is, first, can you tell me what you'll do when you get home today? Then we'll talk about tomorrow. Let's go one step at a time. What's the first thing you'll do if you feel dizzy, for instance? Right. So this example may be about keeping after some post-op. Uh, can you go over, or can we go over just the steps for cleaning the wound first? Then we'll review the follow-up visit. Tell me about what we've talked about today. We'll cover another thing next time. All right. So similarly, there are some things that you want to avoid, or you need to practice avoiding. Anything that's asking too much at once. So examples of when you need to catch yourself. I mean, some of these will come out, but catch yourself and take a step back and break things up. So if you find yourself saying something, go ahead and explain everything we've discussed. Right? You don't even need to have to say from beginning to end. This was just to highlight it. Explain everything we've discussed. It's a little bit unrealistic. It's overwhelming. Summarize your care plan for me. The patients may feel overwhelmed. They may just say, "Oh, I understand it," right? Just to move on. I need you to walk me through the entire procedure prep. It makes it so that they are more likely to make mistakes, and this is where you have to go back and start the whole thing over again. Or this even more innocuous one, because it seems like it's not really asking um, too much of a person. You'll remember everything we talked about, correct? Something like that puts the person in a spot. They feel like they're somehow going to disappoint you if they come out and say the exact opposite of remembering everything. So it's not only too broad, it's also pressure filled, and you'll probably just get people nodding or agreeing. Similar is, you know what to do now, right? You know, assumes understanding, and it's really a way to almost put the burden on the person you are speaking to go back and check through the steps, right? And again, I can't see you, but any of these phrases, when they slip out, it's not it doesn't break down the fact that you need to continue. It's a matter of going back and then breaking things up into pieces, right? There are going to be many points in which you realize that the teach back as you're doing it in the moment is not actually meeting the five core components. That's just part of how it's going to be because it does take practice. It takes practice for it to become fluent. Then remember the component and then try to recompose it. And I can only imagine because I haven't been in those clinical situations that the patient is also looking for other information from you and you are having to think about making sure that you convey all the information in a way that is respectable and also making sure that they learn it. It's not a trivial thing to do. All right. So here we are at the fifth component. Again, as a reminder, we start by acknowledging, we normalize, we share responsibility, break information up. And once you've broken the information up, excuse me, you are making specific focused requests. So the focused questions are a very important element. All of the elements we've spoken about are important. So I wouldn't say just remember this one. But if you ask for one clear bit of information, that can give you confidence depending on the answer that you get. And this is where you also need to prioritize. If there's a lot of information that needs to be shared, but certain ones are critical that you want to make sure have been conveyed, ask a focused question on that one. So for what it can sound like, some examples, right? And remember, these phrases again need to be tailored to make them sound like you, right? Can you tell me how you take your morning dose of the medicine? It focuses in. It's just in the morning. Maybe you'll talk about the other ones later on. Can you walk me through what you'll do when you notice signs of infection? Right? Can you show me how you'd use the inhaler we just talked about? And ideally, you should have shown them also. This is about the multimodal communication. Let's go over the next appointment. Maybe the next appointment is the most important thing that you need to get to the patient today. So after everything you've told them about how to get the appointment, you ask them, can you explain when and where you'll need to go? And you can see that if you haven't normalized it at the beginning, you haven't acknowledged that it can be complex. A question like this may seem and could be taken to be a little bit insulting, frankly, right? It's like, why are you asking me? Do you think I don't know how to go to an appointment? But it's part of the journey. Let me take a step back. It's part of the journey after you've acknowledged, normalized, shared responsibility, and you've broken the information up. By the time you are asking, excuse me, can you explain where you need to go? It's clear that you are working with them together to make sure that they are getting what they need, right? This other one, could you tell me what steps you'll take if your blood sugar gets too low? Okay. So let's go to some phrases to avoid around trying to make sure that you are focused. And these phrases tend to be a lot like the phrases around being too broad. Do you understand everything I just said? That is not targeting anything specific. And you are more than likely just going to get a yes, which is not a good outcome because it's very sure that the person probably hasn't understood certain parts, or you'll get a no, which is a slightly better outcome because even though it's going to mean more time on your hand and actually unfortunately waste your time, there's some hope that the patient can get or the community member can get the more important bits of information. So I have a thing which says don't ask a question you don't know or want to know the answer to. So we shouldn't ask a question like this. Tell me everything I just explained. also not focused. And you're good with all that, right? That's also, again, putting the patient on the spot to not disappoint you, not make it feel like you haven't done it feels like a test to them. You, right. Repeat it all back to me just to be sure. Another test. Hopefully you caught all the important parts. And even if you don't add the summarize for me, something like that is not focused, but it's also pressure filled and confusing. What were the important parts? Wasn't everything you said to me important? And if it wasn't important, why were you saying it to me? Okay. This has been a whirlwind push through some examples, right? I would hope that next week, as we practice, these will become more part and parcel of how you think in when you are inviting someone to participate and teach back with you. It is not trivial to incorporate all of these things in a conversation. That's the first thing to get. It's not trivial. And so practice is what is going to make it better. And part of the way to prepare is to have your own sort of go-to or chosen phrases that you keep somewhere in the back of your mind that you can call on each time. And what we will do next week is, for your context and for the examples that you work on, we want to make sure that we are checking as many of these boxes. I think if you check 3 to 4 out of 5, for the most part, you are doing better than a large swath of people. But let's go for 5. Why not? Let's complete the flower. Okay. Any thoughts before we push into the takeaways? Any comments to share here? All right, let's push forth then with this. So what are some of the key takeaways? And I've been saying this throughout, but I also wanted to call it out. Teach back takes practice to feel natural. Good intentions are the first, but they are not, they are necessary, but not sufficient, right? They aren't enough. Having good intentions of doing teach back. It requires repeated practice to build your comfort and fluency. And what I am loving actually, as I reflect back on these sentences, was to think of how to use them in my everyday life also, right? Just making sure not to be dismissive. Well, whilst teach back takes practice, we are also fortunate that there's a clear anatomy or structure to guide you. Let's step back to our flower here. Acknowledge that what you're talking about may be difficult or complex. Normalize that you do this for everyone and share responsibility. We are in this together. As if you don't understand, it's not that I am expecting you to take the full burden. Maybe I need to explain it in a different way. Break information into smaller parts and ask specific focused questions for teach back, right? It's not enough to say, tell me what we've just talked about. Okay. So certain phrases can backfire even when well-meaning. That's important to know also. So it's almost a little bit dangerous to say we're going to do teach back without thinking through the effective prompts and also the phrases to avoid. Without taking that care, you can actually end up making the person you are talking to feel like they're being tested or being shamed or overwhelming them. Okay. And here's a fourth takeaway. Having go-to phrases makes it easier and more effective. No need to reinvent the wheel each time. Having a bank of phrases lets you call on them almost automatically and focus on the conversation you're having at that particular moment. So using and reusing what works. And I'm super glad that you have the time for us to do workshops also, because the goal is to not just learn what good looks like, but to take the time to create what good looks like that works in your world. So as we wrap up today, and yes, we are almost at the end of the time. We have just a few more minutes. There is a to-do for our next session, which is a teach back workshop. I will ask each of you to bring 3 real life examples from your daily work where teach back could improve understanding or connection. This is going back to building this bank of phrases, right? So use this time, use your peers, use me to come up with this bank. All right, that's what we are doing next week. Bring the examples. We'll work on them in groups. Have the bank, and then you can practice and call on them as needed. Okay. You could also sit and do some of them on your own, but especially if you're able to make the workshop, this will I think it would be helpful just to be able to have others give you input on how it's coming off. So any thoughts, questions before we wrap up? I'm hoping to see a good number of you next week as well. Before I let us go. Sorry, was someone saying something? Let's see.
Yeah, I was just wondering if you can go back to the flower real quick.
Yes, let's do the flower.
And that one.
Mhm.
Got it.
And if you are not a visual learner, just remember the 1, 2, 3, 4, 5 also. It helps. Oh, Althea had it. A lot of times we give a patient written instructions to take home after the visit to remind them of what we talked about. But I know that about 20% of Americans are non-literate or have below basic literacy. Do you have some good, normal, non-judgmental ways to ask about literacy? So, uh, Althea, I think and this I'd love to hear what others say in or think about. It's not so much asking generally about literacy, but it would be asking about the most important parts of what they need to get from the literature, right? So because if they don't have the basic literacy, it's probably not going to change between the time you find out that they do or don't. So it's almost like this is why the toolkit is universal. You do it for everybody. Assume, let me go back, and sorry if I made you dizzy here. I was trying to flash back to this thing. You assume that there is some level in which they are not getting it. In fact, almost assume non-literacy for everyone. And then, if that is the case, what are you wanting to highlight, right? So that would be the way that I would approach it. Not so much, can you go and read more about this at home, but what can we do in this time to highlight the most important things that you should get, even if you can't read? I don't know. What does anybody else want to add thoughts to that? Yes, that's it, right? Emphasize making sure that you verbally and pictorially, right? What we remember, the TAP CV also includes about adapting the language, and part of the adaptation may be that thing may be brought down to what you said, fourth. Oh, here we go. Anna even just said it, 4th or 5th grade level. I would say maybe brought down to the level that you would hope that everyone has some access to. Use pictures. Sorry, I moved away from the pictures, Gary. What was the question or the comment you had about the picture? And thank you very much for Althea. Althea. I think part of what the answer is like it should work even if you are not literate. So what we are handing out should work. What we say to you whilst we are there should get the information.
I think
Oh,
that,
did
sorry,
Gary?
can
Sorry,
you
go
guys
ahead.
hear me? Sorry, I have
Yes.
laryngitis, but I was gonna mute and just, yeah, share one thing. So yeah, I think unfortunately, like we rely so much on written materials in healthcare. And like I had an experience recently where I was seeing someone in the hospital that was being admitted for like he'd had like a health issue that had been going on for years. And like finally it was getting severe enough that he was admitted to the hospital. And I was seeing him in the hospital and talking about the follow-up plan. And he wanted to keep going over like the dates and times of his next appointments and where they were going to be located. And we went over them a couple times. And then I was like, oh, don't worry, because when you get discharged, they're going to give you a printout with all of your appointments and the dates and times and locations. And he very matter of factly was like, he's like, oh, I can't read. Um, and I was like, oh, and then it suddenly made sense because he'd missed like all these appointments as you know, when he was at home. And it's because the hospital will send patients their appointment letter, but he would get these letters in the mail and he couldn't read them. So he had no idea that what they were saying that he had an appointment or what. And then even like our diabetes education program, like they send patients this letter and this cookbook and these like diabetes education instructions. So he was like getting all of those, but he couldn't read them. And so I was like, oh my gosh, we need to totally. And I told like every other member of the care team, I was like, you know, the issue I think has been the whole time that he can't read. And we've been like communicating so much to him through written language. And
Yeah.
no one ever knew until then. And he wasn't even like embarrassed or anything. He just like, no one had ever asked him. And he finally just brought it up. And I was like, oh, don't worry, we're going to write it all down for you. He was like, no, I actually can't read. Like, that's not going to work for me.
Yeah. Yeah. I think that that's powerful. I mean, part of the whole range of things we do, part of it is also multimodal communication. So I don't know, maybe pictures of clocks and dates or somebody to assist him. But that sounds like a tough one, Alithia. I don't know how to solve it. We are right at the time. Thank you so much for this time. It would be super helpful if you just take a minute right now. And it's literally 5 questions.